Hey guys, it's been a while since I uploaded a video, but I wanted to document and record my journey in starting Advanced Med Surg critical care term, and I wanted to show you guys week 1 and week 2. So this is my first day. It's Monday, November 2nd. And it is my first day of Advanced Med Surg. This time I got my lecture on Monday and my clinical is going to be on Thursday. For the first week we're not going to our site, so it's going to be here at home. I'm going to record that. You guys are going to see that in a bit. But I also wanted to record week 2 because that's the first time we are going to go back to clinicals, and I'm so excited because I haven't been to a clinical in a few terms since intermediate med surg, and then it was OB, peds, and then public health. We didn't go. Although I was assigned a location, we were not able to go. I did LA food bank for like supplementing hours, so that was great. Very great experience. If you live in LA or around LA, consider doing LA food bank, even if it's not for your hours. I'm still gonna continue to do LA food bank here and there just to accumulate volunteer hours, and it's a very great experience. You meet a lot of people, but I don't want to talk so much. This is gonna be kind of like a week in my life, kind of, you know, the videos that I always make in like the beginning of my terms. I enjoy this type of video, and I hope you do too. And I'll stop talking and just show you my week in Advanced Med Surg and all the assignments that I have to do. All right.
Okay, that's all I'm saying. I'm not gonna say anything anymore. Exam, your quiz. Our quiz starts at 12:30. You guys, are we good with that? Quiz starts exactly at 12:30. I only have 110 students, so I can take care of you guys. Just, just let me know.
So I lowered my lecture for a bit just so I can tell you guys what my schedule is going to be looking like. This is November, and this is week 1, week 2. So today I have Advanced Med Surg lecture from 12:30 to 5:30. And I have clinicals on Thursdays from 6 a.m. to 6:30. This is going to be virtual first week. Second week we're going to go on site. And I do have a pre-brief sims this week from 1 to 6. We have 3 throughout the whole term. My next 2 are going to be in December. This is the first for this first week. And they give us like a scenario and we have to like, you know, work it through. And for the second week it's going to be the same except for the sims. It's not going to be there. I do have another class. It's a ethics class, and I have to, for that I don't meet with the professor. It's more like independent work, but I have to turn in discussions on Wednesdays, and then responses the rest of the days, and assignments or essays on the side. So here's my binder. This is how I divided it. For this term, the first 7 weeks, and each week has different chapters to read. So I divided my notes into weeks, just so I could be more organized. And ATI assignments for my Advanced Med Surg. Here's the medical ethics discussion divider, ethics notes, reflections, and clinical ATI assignments, and other. The other, that's where I keep my blank pieces of paper. But yeah, this is pretty much it, and later on it'll be full. Guys, I just finished my lecture class, and I'm overwhelmed with first day information. And since I finished, I wanted to go ahead and get started with my other class, the discussion prompts and like little assignments that I have to do for the week. And I'm gonna go ahead and write that down in my agenda because I haven't much. And yeah, I'm gonna go ahead and read my ethics class book and answer the first response for the first discussion. Hey guys, so today is Wednesday. I know it's been a day since I picked up the camera and showed you day in my week, but yesterday wasn't relevant. I just took my kids to the doctor, and it wasn't school related, so I didn't want to show that. And it was my first time driving with my mom and my kids in my van. So if you haven't seen that, I just recently got my license at 28 years old. That's what I did this 2020. I learned how to drive and I got my license. So now I'm just practicing and getting the hang of driving and getting over the fear of driving with my kids. And today is Wednesday, the day before my clinicals. And it's still the first week, obviously. And I have to do clinicals virtually, so I'm gonna be here at home, and I'm setting up because when I wake up in the morning, my clinical starts at 6 a.m. sharp. I have to be up at 5 in the morning, and my family is gonna be asleep, and my kids are too, so I have to get everything ready the night before. Well, especially like the equipment that I have to, like my computer and the ring light. I don't want to turn on like the big lights because everyone's gonna be asleep. So I'm gonna be here in my dining room, but because my mom sleeps in the living room, we have like a couch bed thing. She sleeps in the living room, and if I turn on the light from the little dining room that we have, it'll be in her face. So I'm gonna use the least amount of light, and yeah. And I do get my uniform ready the night before, so all I have to do is get up, brush my teeth, wash my face, comb my hair, get dressed. I don't have to be looking and through my clothes in the middle of the darkness of the morning. Okay, so I'm gonna show you my little setup in the dining room, and then you can see me get my uniform ready. And then tomorrow morning is my clinicals. I'm gonna wake up so dragged because it's my first 12-hour clinical in a term. So last term we didn't have clinicals like this, so I got used to it. So here we go again, and I love it. It's just waking up in the morning and being in front of the computer for 12.5 hours is a drag, and I'd rather much get up in the morning and go to a hospital or a site. So yeah. Okay, so this is the little dining room. This is my daughter's little book area, pencils and marker stuff, and this is my little area. We made some cupcakes for Halloween. I'm gonna get ready to throw those away, but they're there. And okay, I got the ring light, the computer on the stand that I bought that improves my posture because I have very bad posture. And yeah, okay, and see, this is my mom's couch. She makes it into a bed, and then here's it. So if I turn this light on, it might be a little too bright for her, so I'm just gonna have the ring light just so the teacher can see that I'm there. And yeah, so we'll see how that goes tomorrow. I'm gonna go ahead and grab my uniform. Sorry for the mess, guys. I have not organized my clothes, but this is my little uniform area. I'm probably gonna be cold in the morning, so I'm gonna wear we have a school undershirt. Actually, you know what? Yeah, I'm gonna wear the school undershirt because it's the same color. And these white ones, they're kind of raggedy, but they're very comfortable to wear under. So, okay, I got my pants. the school uniform undershirt and the top. I'm gonna go ahead and set it up here. Alright, I got a mess, guys. Don't mind it. Oh my goodness. Okay, I'm gonna put my badge here, because you know you gotta have that ready. What else do I need? Oh, yeah, I need white socks. Okay, white socks. And then all I have to do in the morning is get up, wash my face, wash my teeth, put my hair back, and then put my uniform in to the dining table. And you'll see that in the morning. Bye, good night. Good morning, guys. I am trying to log in into my class. It's 5:57 in the morning, and I'm dressed, washed my face, brushed my teeth, got my uniform on. Yeah, I got my setup. I'm good. I'm so tired. Not tired, just like I'm not used to waking up early for class. So I'm logging in. All right. Okay, everyone's there already, so okay. Should be good. I got some glasses for my daughter and I, since we're doing like virtual classes and we're on the computer all the time. I bought these glasses from Amazon. I'll show you. Here, I guess they help you with the blue light from the computer, and they don't damage your eyes. So I'm gonna go ahead and put that. All right. Okay, there we go. Okay, so these help. They help. They make my eyes not feel tired as much as like if I wasn't wearing them. I feel like when I don't wear these, my eyes like pop out. But with these, it's like they relax.
I'm not. Oh, kids. So it's feasible. It's not easy, but it's feasible. You just have to put your mind to it, and it sounds like you have a great partner to help you. So.
Thank you. Thank you.
Well, welcome.
Yeah.
Very welcome. Let's see, Carolina.
Yeah. Good morning, guys. My name's Carolina.
Do you go Carolina or Carolina?
Carolina. Yeah, some people call me Carol. Yeah, it just depends. I would like to
What
go.
do you prefer?
Carolina.
Carolina.
Yeah.
Perfect.
Okay, so I would like to go into pediatrics as well. I would prefer a NICU. I was a NICU baby myself, so that's very interesting to me. I have 3 kids, and the last one I got pregnant during nursing school. So after funds, in funds actually, that was like a year and a half ago. And then after that, I failed out during the mental health and PA, and then I appealed. They accepted me back, but I couldn't go back because I was going to have my son. So then I came back when he was a month. So I know it is hard. I was very nervous, but it's very doable. So you got this.
Good job.
Yeah.
Very good.
Yeah.
Let's see, who's next?
So it is currently 7:34, and we had a conference from 6 to 7:34, and our professor just told us, since it's virtual today, we're gonna have to work on Swift River. We have to get patient information from Swift River, from one of the scenarios, and we have to write a nursing process worksheet. And she told us how she wants it laid out. We also have to do med math, which is in the Swift River, and we have to turn that in. And yeah, she basically went over the syllabus and all the assignments, when they're going to be due, where we meet when we do go to our site for the first time next week, how we're going to have lunch, and how basically everything that we have to do in the site, since it is, we are in this pandemic, and then patients could have COVID-19. We're not going to be on units where there are patients with COVID-19, but just for precautions, we're not allowed to bring like bags or anything, just anything that we can carry in our pockets. Our stethoscope, I think we do have to take, that fits in the pockets, or around the neck. She was telling us about the parking situation, where we can go eat for lunch. Yeah, we did introduce ourselves, as you saw. That's always embarrassing a little bit. Yeah, so she basically went over everything that we have to turn in. We do have a scheduled vacation for Thanksgiving week and for Christmas, so we won't be meeting that day, but then we will resume. Yeah, my son just woke up, so he's coming to the living room, or maybe he's going to the restroom. I don't know. I don't want the baby to wake up because I want to have some breakfast now. I'm gonna have breakfast, and then I'm gonna start the Swift River. Yeah, our school does keep track of whether we're in class or not, and the way that they do is that when we first get on the class, we have to post a code for our attendance, and then throughout the day, the professor usually posts a question, just to make sure that they make sure that we are paying attention. I scared you? Yeah, I'm in class, honey. Yeah. So I wrote down the hours that she said she was gonna post the questions, and I put in alarms at that time. So I'll stay on top of that. And that's one way, because if you don't answer the question to the questions that they post, that counts against your attendance, and basically you miss hours, and you can fail if you don't answer those questions. So yeah, alarms help a lot because I tend to forget. So yeah, so that's pretty much today. Yeah, I'll talk to you guys later for post-conference and see how the day went. I made my mom and I some tea because it's cold. It's getting cold. And yeah, just gonna do Swift River. My kids are noisy. This is what I gotta work with. This is how I have to work here at home. I don't like it. I rather much go in person. Because I'm still breastfeeding, so my son is clingy and he wants me to like breastfeed him like every hour. It feels like. Yeah, so I gotta get through today, and then next week we're gonna go to the hospital, so I won't have kids around and I can get my skills. Okay, well, I have to get back to my work, so I'll talk to you guys later. Good morning, guys. Today is Friday of week 1 still, and today I have Sims lab, so I'm very nervous because they always give us scenarios. And in Advanced Med Surg we have 3 sims. Today is my first one, so it's called pre-brief. It's basically like an orientation, but at the end I'm sure they're gonna give us a scenario. Oh, I'm so nervous because they always give us like a critical patient. Well, I'm sure they're gonna give us a critical patient. That's what like Advanced Med Surg is. and we're gonna have to like be the nurse. Okay, so I'm so nervous and I'm getting ready. And you guys know my house is small, so today I'm not gonna be in the dining room, well, kitchen basically. I'm not gonna be in that table. Look at my little setup with my kids' little table and one of their seats. And this is where I'm gonna be for Sims. That's my bed, and I have everything ready next to me. I have my stethoscope in this little pouch because I'm gonna need my stethoscope and my pen light, and I always have one of these like normal values and this too, just so I can kind of reference, and an alcohol wipe to clean my stethoscope and my pen light, make sure it's working. I'm sure they're gonna ask for it. My Med Surg book, they always require that. My drug book, some water, my watch, my pen bag, computer. I have to do an assignment really quick right now, and I have my uniform here. I already have my pants on. I'm gonna put some white socks and then put this on when it gets closer. My simulation today starts at 1. It's from 1 to 6. Usually I've always gotten sims from 7 a.m. to 12:30, something like that. So this is a nice change. From 1 to 6, I rather that because it's not like so early. But yeah, guys, I'll let you guys know how my simulation goes and like what scenario. And well, actually, you know what, I don't think I can talk about my simulation. So I have my Woody, he's gonna be my patient, and this is gonna be my phone to call the doctor and tell him, you know, what's going on. So yeah. Hi guys, welcome to week 2. Today is Monday. My Advanced Med Surg quiz number 1 is today, and I am on my bed. This is where I come, where it's peace and quiet, and obviously I can take my quiz. We go on to a Zoom meeting and are proctored. She kind of takes a look at our environment and where we're going to take our quiz. So I'm studying right now the last few minutes. Hi. Okay. And I have to put everything away so when they take a look through the camera, they can see that I don't have any notes out and stuff like that. So let me show you guys. This is my mess. I just finished tutoring with the professor. It was from 11 to like 12. It's 12 to 12 right now, and my class starts at 12:30. So yeah, so this is how I usually get organized other than my agenda. I usually take a sheet of paper and write all the assignments and the points and the week they're due, and then more details about the assignment here, and then I highlight when I finish it. I do weekly readings for my class as well. So for week 1, these are the readings that I have to do. This is for text, this is for ATI, and I highlight it once I finish reading. And for clinicals, this is the same thing. Assignment, the points, the week, and the details, highlighting what I finished. So week 1 I finished, so week 2 I have to do that before my clinical day on Thursday. And this is for my medical ethics, the same thing. Yeah, so I showed you guys how I organized this. I wanted to show you guys my first notes. This is how I usually do it. I didn't finish all of my notes. I just concentrated on reading just to see how that goes for me, because usually when I write notes, I usually tend to like do it so detailed I don't get to finish reading sometimes. So I did like the first chapter and then I went and read. Let's see how that turns out for me this week. But yeah, guys. Oh, the week 1 is always very hectic for me because it's like my week of like adjusting and seeing how things are flowing. But yeah, guys, I'm gonna go ahead and just look at my notes like a few more minutes, and then I'm gonna log into the Zoom And my kids are still playing in here, but once I get started, they're gonna have to go out. Hi guys, I forgot to update you guys. It was about, like, Monday was about to end and I wasn't gonna update you guys. I finished my class and we did like and I think my school is doing a new thing where instead of the professor lecturing most of the time or at all, the students are the ones who do presentations on each topic. So my group, I'm group 2. So I did tuberculosis, and we had to, like, my group had to, like, do sections like symptoms, like clinical manifestations. I did the NANDA and like expected outcomes and stuff like that. So we had to present. So there was other groups that did like other topics. So it was basically students teaching students, and I mean, it's more work to do because we have to do the presentation every week. It's like a different topic for each group. It's more work, but I feel like it keeps us engaged in what we have to do. It's not that hard anyway. So yeah, we did that. And guys, I was expecting to do so much better in my first quiz, and I did horrible. Okay, I'm gonna be honest with you guys because I like to keep it real. I got a 68 and I'm very devastated because I thought I was gonna do better, but dude, my walls are thin as paper, and my son started crying so loud. I guess his sister didn't want to play with him, so he like threw a fit, and I could hear him. I felt like all my other classmates, because we were in Zoom and they had to have the microphone on, and you know, the proctored man, and I felt like they could hear him. I could hear him, and every time I read a word, like, I didn't, like, it wasn't registering in my mind. So I think that had a lot of play, and I usually, before I begin a quiz, I let my kids know, like, okay, this for, you know, some time I'm gonna start my quiz. Can you guys keep it down? So it's not as bad other times. It's rare when it's really bad. And today was one of those days. I didn't let them know. I didn't talk to them before my quiz. So they thought that I wasn't doing anything. So usually I let them know, you know, it's time to be quiet. Or not be quiet, but just keeping it down, playing quietly. If you come to the restroom through the room, you have to keep it, like, no, don't talk to me. You just go straight to the restroom, do your business, and get out. But that wasn't the case today. Oh my goodness. And at one time, my daughter came to the restroom, and my son came in after her, like, yelling, wanting to talk to me. And I'm like, get out, get out, get out. I'm taking my quiz. Don't bother me. But yeah, there was just a lot of questions that I wasn't really paying attention to it. So I got a 68, and I gotta step it up, step it up, step it up, step it up. All right, guys, I'll see you guys. When's my next time? Oh, clinicals. You'll see me in clinicals, and like follow me around on that day. I can't show a lot, obviously. HIPAA and like patient violation and stuff like that. So I'll just show you like what I can. All right, guys. My kids are watching Trolls, so it's time for me to relax. I was reading with my daughter some frequency words, and now I can like kind of relax before I like start doing other assignments. I did answer my first discussion for week 2 for medical ethics, so I'm trying to knock out these little assignments before clinicals, because that day after clinicals I feel like it gets more hectic, cause I don't know why. So I like to do my assignments before that day, and then just like leave like the last minute stuff for Friday, Saturday, and Sunday. All right. Hey guys, it's Tuesday, the next day. I wasn't gonna film today, but I did join a tutoring session webinar for school, so it supplements the information that we're learning this week for next week's quiz. So that's what I'm doing, but at the same time I'm cooking for the kids, so I'm over here listening and cooking. it's Wednesday and it's the day before we go back to clinicals. Tomorrow is Thursday and it's my first time in a hospital since forever and I'm so excited. It's 3:30 and I'm getting ready for tomorrow. I want to get early. I want to get things done early. I went to TJ Maxx earlier and I bought a wreath, like a Christmas wreath for my door, and it looks so nice. I'll probably show you guys. And I also bought my mom some new like couch pillows. But I went out to buy a mini clipboard because my professor said we can't take bags to our facility for some reason. The clipboard that I bought looked big. It's this one. And I was like, okay, so everything that I have to take needs to be able to fit in my pockets, okay? So my stethoscope, oh, obviously I'm gonna have it in my shirt pocket. So I'm gonna stuff that there. Pens, 2 pens and a highlighter, and I like taking pencils. So 1 pencil. And then I was like, okay, well, where is this clipboard going to? So like I was saying, because I keep getting phone calls while I'm trying to record. Anyways, I was like, okay, where is this gonna fit? So I came and I put it in. I'm like, yay, it fits. I can put my nursing process sheets and other stuff here. I don't have to worry about that. But I don't want it on my shirt. So I was like, is it gonna fit over here? And it doesn't. What a bummer. Oh, wait, it looks like it does, but let me shove it. Maybe if when I have it on, I can just like shove it, but then it's gonna feel weird. Okay, I don't know, but it fits up here, so I'm not too stressed out because it does fit. Okay, guys, I'm gonna get everything out and ready, and let me move this crib. Okay, I'm gonna fold this up, put it over here, because this is my spot. I have my ID, my watch is already on. I'm gonna take it off, put it here too. Oh, I do need a long sleeve because we're gonna meet up like at 6 a.m. Outside of the hospital and then go back in. It's probably gonna be cold. I am not going to take my van. I am a new driver and I'm still like scared to drive. I've never driven at night or really, really early when it's still dark, so that's something that I'm gonna have to get used to. Yeah, so I'm kind of scared to take my van, and if I don't find parking or anything like that, I'm gonna be all over the place, so I'm just gonna Uber it or Lyft it there. And I'm not gonna be worried. I'm just gonna wake up, get ready, call somebody to take me to the spot, and I'm good. No bags, no lunch. We're just like a credit card or like cash. But I'm gonna stash it in one of the smallest pockets. There's like a hidden pocket in one of them where you can like stash small things. So my money ain't falling out. Okay, guys. So I'm gonna get ready for tomorrow. I still have like 3 assignments to do before tomorrow that are due tonight. And yeah, that's my Wednesday. Good morning, guys. It's Thursday. It's like 5:15 a.m. I just finished getting ready, and well, actually I'm still gonna like do my eyebrows and mascara a little bit just to look alive. And my dad came to take me. That wasn't in the plan, but he wanted to, so he's here, and we're gonna have some breakfast and then we're gonna go ahead and go. I have to be there at 6 a.m. at a Starbucks, but it's like 10-15 minutes away from my house, so we still got time. All right, guys, let's see how my day goes today. I'm so nervous. Oh my god. Hey guys, so I came to the restroom and we just finished lunch, and then I'm in here trying to fix my hair because it looks cray. Oh my gosh, look how crazy I look. Anyways, I'm gonna go back to the floor, work with my nurses. It's been a crazy, great day, but let's keep it going. I'm so excited. I'm on my way back home, and we just finished post-conference. My dad brought me in the morning. Instead, I didn't get an Uber or a Lyft because my dad brought me, but I'm on my way back home. I'm going to take the train. It's a few blocks away from here, and the train is only like two stops, so it's not hectic. I didn't bring my van, or I didn't drive because I didn't want to like have the hassle of finding parking. So I stopped by to get my kids some Cold Stone. I just like always taking my kids a treat every time I'm away from home for a while. They're gonna love the treat, so I'm excited to get home and see their faces. So it's the end of the day and I am home from clinicals, and the first thing that I did when I got home was take off my shoes outside and came straight in to the restroom and took my clothes off, put them in a bag, and sealed it up. And then I hopped in the shower, and then I got out and I started to do my nursing process sheet. Usually we gather all the information at the hospital. We fill it out, and then our professor let us complete it at home after if we didn't finish it, and then we submit it before midnight today. So the same day as clinicals, just get home and finish, and then submit it. So I went ahead and did my nursing diagnoses and planning and interventions that I did today for this particular patient. Yeah, so today was a really good day. Let me so some skills that I was able to do were putting patients on a bedpan and cleaning them after. I observed a straight catheter being inserted on a woman. I took off an IV. I did a head-to-toe assessment on my own. Well, I was working with two nurses, the main nurse, and then she was precepting, or the new grad. She was on orientation, so I was working with them, and I was helping the new grad nurse. She went to go get the medications, and she was teaching me how. And when we took the medications to the patient's room, we thought he was in the restroom. So, she knocked. She's like, "Oh, sir, are you okay?" And she's like, no response. So she's like, "Okay, that's weird." And then I kind of looked, and then she knocked again and no response again. So she opened thinking that the patient was going to be on the floor or something. And there's no patient, just the light on in the restroom. And we look at the bed, the patient's not there, and we're like, "Okay, where's the patient?" But they take the patient somewhere else, without letting anybody know. I mean, if they would have taken the patient somewhere else, they have to communicate that, right? So we're looking for him in the halls because the patients could walk or ambulate, and we were looking for this patient everywhere and we could not find him. So the unit had to call the code green, which is like the patient missing or something. So he just got up and left, and we just never saw him again. So so yeah, that's that. That was interesting. I had heard of it, but I had never experienced that. And I got to observe, like I told you guys, I got to observe the straight cath. Poor lady, she was in pain. I think she had a UTI. That's why it was like hurting. What else? Yeah, I was very nervous, guys. Today was my first hands-on clinical in months. You guys know COVID-19 got in the way and we lack skills. So, I was very nervous. I was very nervous because I forgot a lot of the medical terminology and like what to look for, how to write it on my nursing process sheet, or how to verbalize it. Just because when you're not practicing it, you kind of lose it. I mean, one thing is to like watch videos and like do little modules here and there, and another thing is to physically do it and say it. So, yeah, but today was great. I learned a lot. The nurses were great. Um, the other students are very helpful too, and we're like all in this together type thing. Yeah, we took our lunch, and there's a lot of like food places around there, so I'm very glad for that. We did have good food for lunch. We yeah, that's all I can say, guys. I don't want to like talk your ear off because it's already like 10 minutes of me sitting here and talking to you about my first clinical experience in a long time. I was just so excited for this. A lot of other people did not get to go to a site because there's still a lot of places that are not accepting students to go personally or like physically. Yeah, I know there was another school, there was other schools at the place, but first come, first serve. We were there early, so we got nurses and stuff. But I think this other school was coming in after, like, for a later shift, so we went to, like, post conference, so now they can step in and help. So, yeah, that's pretty much it. These 2 weeks of Advanced Med Surg. I'm so glad I do these kinds of videos because then I can look back and be like, oh, okay, yeah, that was fun. I remember that. Or, this nursing journey. But if you watched till this point and listened to me yabble about my experience, thank you. And hope you enjoyed listening to my experience. And I'll see you guys next time.